Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Dehydration. Introduction. Dehydration happens when you lose more fluid than you take in. This means your body does not have enough water and other fluids to function normally. If you do not replace lost fluids, you may get dehydrated. You can usually reverse mild to moderate dehydration by drinking more fluids, but severe dehydration requires immediate medical care. This program explains dehydration. It discusses symptoms, causes, treatment options, and prevention methods of the condition. Dehydration. When you are dehydrated, your body does not have enough fluids to work properly. More water is moving out of the body than the amount of water that is taken in through drinking. An average person on an average day should drink 8 8-ounce glasses of water. People lose water every day in the form of water vapor in the breath we exhale. We also lose water in our sweat, urine, and stool. Along with the water, small amounts of salts or electrolytes are also lost. Electrolytes are chemicals that are important for the cells in the body to function. Electrolytes such as sodium, potassium, and others are needed by cells to generate energy and remain stable, for muscles to contract, to move water and fluids within the body. Dehydration usually means a person has lost enough fluid so that the body begins to lose its ability to function normally. This causes the symptoms related to fluid loss. Dehydration can lead to serious complications, including coma and death, heat injury, hypovolemic shock, kidney failure, seizures, swelling of the brain. When not treated promptly and appropriately, severe dehydration can be fatal. Symptoms. Mild to moderate dehydration may cause a dry or sticky mouth, decreased urine output, few or no tears when crying, sleepiness or tiredness, thirst. Mild to moderate dehydration may also cause constipation, dizziness or lightheadedness, dry skin, headache. Severe dehydration is a medical emergency. Symptoms include dry mouth, skin, and mucous membranes, extreme thirst, lack of sweating, little or no urination, sunken eyes. Severe dehydration may also cause delirium or unconsciousness, fever, low blood pressure, no tears when crying, rapid breathing and heartbeat. Another symptom of severe dehydration is shriveled and dry skin that lacks elasticity. If the skin is pinched into a fold, it does not bounce back. In babies, dehydration may cause sunken fontanelles. Fontanelles are the soft spots on the top of a baby's head. Unfortunately, thirst is not always a reliable gauge of the body's need for water. A better indicator is the color of your urine. Clear or light-colored urine means you are well hydrated. Dark yellow or amber-colored urine could mean that you are dehydrated.
Babies, children, and the elderly are at a higher risk for dehydration. Contact your healthcare provider right away if someone at high risk has symptoms including diarrhea with or without vomiting or fever, irritability, disorientation or sleepiness, the inability to keep down fluids. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. Dehydration happens when there is not enough water to replace what is lost throughout the day. Common causes of dehydration include diarrhea or vomiting, excessive sweating, fever, increased urination. Severe acute diarrhea is diarrhea that comes on suddenly and strongly. It can cause a severe loss of water and electrolytes in a short amount of time. If you have vomiting along with diarrhea, you lose even more fluids and minerals. You lose water when you sweat. If you are active and you do not replace fluids, you can become dehydrated. Hot, humid weather increases the amount you sweat and the amount of fluid you lose, but you can also become dehydrated in winter if you do not replace lost fluids. Fever can also cause dehydration. The higher your fever, the more dehydrated you may become. If you have a fever in addition to diarrhea and vomiting, you lose even more fluids. Increased urination is most often the result of undiagnosed or uncontrolled diabetes, a disease that affects the way your body uses blood sugar. Diabetes often causes increased thirst and more frequent urination. Dehydration can also be caused by alcohol, certain medicines such as diuretics, antihistamines, blood pressure medicines, and some psychiatric drugs. Anyone can become dehydrated if they lose too many fluids, but certain people are at greater risk, including endurance athletes, babies and children, older adults, people living at high altitudes, people with chronic illnesses, people working or exercising outside in hot, humid weather. Diagnosis. Your healthcare provider can often diagnose dehydration on the basis of physical signs and symptoms. If you are dehydrated, you are also likely to have a faster than normal heart rate, low blood pressure, especially when moving from a lying to a standing position, reduced blood flow to your limbs. To help confirm the diagnosis and pinpoint the degree of dehydration, you may have other tests, such as blood tests to check for the levels of your electrolytes and how well your kidneys are working, urine tests. If it is not obvious why you are dehydrated, your healthcare provider may order additional tests to check for diabetes and for liver or kidney problems. Treatment. The only effective treatment for dehydration is to replace lost fluids and electrolytes. The best approach to dehydration treatment depends on age, the severity of dehydration, and its cause. If you are a healthy adult, you can usually treat mild to moderate dehydration by drinking more fluids. It is best to drink water or a sports drink. To treat dehydration in children, use an oral rehydration solution such as Pedialyte. In an emergency situation where a pre-formulated solution is unavailable, you can make your own oral rehydration solution by mixing 1/2 teaspoon salt, 6 level teaspoons of sugar, and 1 liter of safe drinking water.
Keep giving liquids slowly until your child's urine becomes clear in color. If your child is vomiting, try giving small amounts of solution at frequent intervals. Give 1 teaspoon every 1 to 5 minutes. If your child continues to throw up, wait 30 to 60 minutes and try again. Room temperature fluids are best.
Do not stop breastfeeding when your baby is sick, but give your baby an oral rehydration solution in a bottle as well. If you give your baby formula, try switching to one that is lactose-free. Avoid giving your child caffeinated beverages, fruit juices, gelatins, milk, sodas. For exercise-related dehydration, cool water is your best option. Sports drinks containing electrolytes and a carbohydrate solution also may be helpful. Children and adults who are severely dehydrated should be treated in a healthcare facility's emergency room. They can receive salts and fluids through a vein or intravenously. Intravenous hydration provides the body with water and essential nutrients much more quickly than oral solutions do. To prevent dehydration, drink plenty of fluids. You can also eat foods high in water, such as fruits and vegetables. Under certain circumstances, you may need to take in more fluids than usual before, during, and after exercising. When you are ill, when you are outside and the weather is hot or humid.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Dehydration happens when you lose more fluid than you take in. This means your body does not have enough water and other fluids to function normally. If you do not replace lost fluids, you may get dehydrated. Mild to moderate dehydration may cause a dry or sticky mouth, decreased urine output, few or no tears when crying, sleepiness or tiredness, thirst, constipation, dizziness or lightheadedness, dry skin, headache. Severe dehydration is a medical emergency. Symptoms include dry mouth, skin, and mucous membranes, extreme thirst, lack of sweating, little or no urination, sunken eyes. Common causes of dehydration include diarrhea or vomiting, excessive sweating, fever, increased urination. The only effective treatment for dehydration is to replace lost fluids and electrolytes. The best approach to dehydration treatment depends on age, the severity of dehydration, and its cause. If you are a healthy adult, you can usually treat mild to moderate dehydration by drinking more fluids. It is best to drink water or a sports drink. Children and adults who are severely dehydrated should be treated in a healthcare facility's emergency room. They can receive salts and fluids through a vein or intravenously. To prevent dehydration, drink plenty of fluids. You can also eat foods high in water, such as fruits and vegetables.
Thank you for using Explain.